Good afternoon, everyone. It is good to see your faces. I miss so much the chance to be together in person, chance to see you all in the hallways or in meetings or in, over lunch or something else. And so it is reassuring to me to have this sort of contact at least. Looking forward eagerly to the day when we can have we can sit down across the table from each other. But I'm pleased that so many of you are turning up for this discussion and others. As I think people know, I started hosting Dean's discussions maybe 4 years ago now, because people would say, gee, I don't know what the Kennedy School is doing on a certain topic, or are we doing anything on that topic? And often we were. Often we had real experts at the Kennedy School doing important work, interacting with practitioners, doing research, guiding students on topics. But those of us who weren't in those classes or didn't know those people well wouldn't know of it. And so we started to have these discussions on issues of current interest. And one of the topics of very important interest over the last 4 months now has been the pandemic and all of the different ways in which the pandemic is affecting our societies. Often in bad ways, but with possibilities, I think, for building better societies in the future. So thanks to all of you for joining us today. I am particularly grateful to Sarah Wald, my chief of staff, who will moderate the conversation, and to the 4 amazing faculty members who are our panelists today. Let me introduce them very briefly, and then we'll just turn things over to Sarah and to them. In alphabetical order, the first panelist is Hannah Riley Bowles. Hannah is the Roy Larsen Senior Lecturer in Public Policy and Management at the Kennedy School. She is the chair of the Management, Leadership, and Decision Sciences area. She is the co-director of the Women in Public Policy program. And so she has plays a very important role in a lot of things that are going on around the Kennedy School, and has been so crucial in helping to build up the Kennedy School's capacity in leadership and decision sciences. Second is Kim Leary. Kim is on the faculty of the Harvard Medical School, the Harvard Chan School of Public Health, and beginning in 1 week on the Harvard Kennedy School faculty. We are delighted that we have lured her to join us. Kim comes to us with a just tremendous array of experiences in a lot of aspects of healthcare and public management and public policy. So Kim, it's wonderful to have you here for this event, and we're looking forward to so much more of you in the years ahead. Zoe Marks, the third panelist. Zoe came to Kennedy School a few years ago as a lecturer in public policy. She works on conflict and political violence. She works on race and gender and other aspects of inequality, on peace building, on African politics. Zoe came along to a meeting I had in New York, talked about work the Kennedy School, she and other people at Kennedy School are doing on Africa. And so Zoe, it's wonderful to have you here today to join this conversation. And fourth on the panel is Janina Matuszeski. Janina is a lecturer in public policy. She works on program evaluation, on development economics, political economy. A number of the students on the call have probably had her in their courses, as the professor in their courses. Janina, it's great to have you here as well. I should say Janina also served in the Peace Corps, worked for Oxfam America, so she has a wonderful background in the practice of the things that we talk about at the school. So I'm going to get out of the way now and just listen. Sarah, I'll turn this over to you.
Welcome, everyone. We're very happy to have you here, particularly some of our incoming and newer students who have signed up for this. Today's discussion is titled COVID-19, the Pandemic and Gender. It's one of a series of 4, possibly 5 this summer that are roughly framed around the pandemic. But as Hannah said in the chat, I don't know if everyone can read it, but this is really not about the pandemic and gender in a discrete way, that the lived experience of the pandemic is it's impossible to separate gender and what is going on in the pandemic from issues of race and anti-Blackness and inequality generally, both in the US and worldwide. So those themes are going to run through what everybody says. We're going to hear from the four panelists now, and then we'll open up to questions and answers. I will call on people. You can raise your hand virtually, but we'll set that up when we hear from the four panelists. So we're going to start with Hannah Riley Bowles, who is going to set the broad framework here for us.
Thank you, Sarah. So I thought I would start off talking about gender and COVID-19 from two different perspectives, two different ways of thinking about gender. So one way that we think about gender, probably the more common way, is in terms of demographics or types of people. But another way we can think about gender is in terms of gendered norms or archetypes, the yin and yang of the feminine versus masculine ideal. And I'm gonna talk about that second idea toward the end. I'm gonna start off talking about gender in terms of types of people. And I want to highlight three sets of concerns that I have about increased gender inequality related to the pandemic in terms of job losses, unpaid care work, and domestic violence. So in terms of job losses, I'm particularly concerned about worsening economic insecurity for underprivileged women, among whom women of color are overrepresented. So relatively low wage, female dominated sectors of the economy, like hospitality and retail, are among those hardest hit by the pandemic adaptations. In general, women are more likely than men to be insecurely or informally employed. And so this will make them more vulnerable in general in a moment like this where there's an extreme or market economic downturn. Now, in terms of unpaid care work, my second topic or bucket, unpaid care work is really one of the reasons why women tend to be more insecurely or informally employed than men. Women have historically and continue to do more unpaid care work than men, childcare, elder care. And now in the current crisis, this sudden and sustained backflow of caregiving and early educational labor into the home, and also, caregiving for ailing relatives is hitting women more directly than men. I'd love to talk about fathers if we have a chance to in this, but in my 5 minutes, I'm not gonna dig into that topic. But there is a serious concern that this, backflow of care labor hitting women disproportionately is going to undermine privileged women's careers, but that it also is, all the more threatening to women who may have only, a tenuous grasp on stable employment. Now, my third bucket of concerns relate to domestic violence. So we know that pandemics and economic crises increase women's risk of domestic violence. And again, unfortunately, while anybody can fall victim to this type of violence, evidence does suggest that women, less privileged women, women of lower socioeconomic status are at increased risk of domestic abuse and other forms of gender-based violence. And we also know that being a victim of a sexual assault or crime and domestic violence undermines or increases one's risk of lasting economic insecurity. Now, I talked about men and women. What about trans and queer people? I am not aware of any specific evidence on the effects of the pandemic for people who are transgender or gender nonconforming or queer, but broader evidence suggests that they tend to be overrepresented among the economically insecure and also among the victims of gender-based violence. So I fear that that is a population that may be especially insecure coming out of a protracted economic and health crisis. Okay, I want to close on what I actually see as a more hopeful note that goes back to the idea of gender not as types of people, but as cultural archetypes. And I'd like to propose in closing that this is actually a moment in which feminine ideals of care, community, loving relationships are actually in ascendance. So what we typically associate with leadership in crisis is this masculine ideal of being indomitable, invulnerable, you know, I can't get sick, fighting threats with power and control, whether that's control over money or other resources or control over people, even the ability to dominate with violence. But I think from a lot of people's perspective, what is the people who are being viewed as the heroes in the current crisis are not those prototypical hypermasculine types. They are folks like the frontline healthcare workers who are overwhelmingly women. They are the female leaders of state who have been observed to be leading with compassion, taking care of people so they can flatten the curve and reopen the economy. And I know I saw Wendy Sherman in the room, and she's going to actually lead a discussion this summer on this question of how effective some of these female leaders of state have been in the current crisis. And then in the Black Lives Matter movement, I just want to highlight, and I know Zoe will talk more about this, but a lot of the people who are the leaders in that moment are female community organizers. And I think another crucially important voice right now has been the families of the victims and their ability to say, wait a minute, these victims of anti-Black police violence, they are not statistics, they are not atomistic criminals, they are fathers, they are sons, they are brothers. And so I'll just close with, you know, a hope that this ascendance of care and compassion that we're seeing will have a lasting impact in our society, or at a minimum on how we think about the types of leadership and community values we need to steer ourselves out of troubled waters and to, you know, higher ground.
Thank you very much. Next, we're going to hear from Kim, who is going to continue some of these themes about the impact on women and some of the intersectionality points here, but particularly talking about some of the health and mental health impacts. Kim.
Sure. Good afternoon and good evening and good morning, because I know people are tuning in from all over. Let me begin first with 3 points. The first is that I do think it's really important to take an intersectional perspective, to look at race and gender together, because otherwise, when we fail to do that, too often, some of us, girls and young women of color, are invisible in our policy conversations, including about COVID-19. Now, also to the point of intersections, we all know that we're in the midst of multiple concurrent and intersecting pandemics, the health crisis, an economic crisis, and a crisis of racial injustice. And third, I'd like to, because I'm a clinical psychologist, just put many of these, all of these actually, in the context of mental health, because each of them has a mental health impact. We know that serious illness like the pandemic, as well as all the uncertainty that attends it, and economic instability affects stress and coping. Police violence, of course, affects individuals, families, and communities. And we heard last time from Professor Ang, who spoke about this. And even in the recent calls to defund the police, which means different things to different constituencies, many of those calls include shifting policing budgets to the mental health system. So increasingly, mental health is also emerging as a crucial dimension of public policy against the backdrop of these various pandemics. We already know about the racial impacts of COVID-19. In fact, the panel on Monday took up that, so I won't reprise that. But let me say a little bit in addition about the gendered impacts of COVID-19. First of all, most of the data indicates that men are more likely to die of COVID-19. The exception is in Massachusetts and a few other areas. But when it comes to the economic consequences of the pandemic, as Hannah mentioned, working women do bear the disadvantage. Just one statistic, from February to May, 11.5 million women lost their jobs as compared to 9 million men. And as Hannah also mentioned, with 1.5 billion children out of school worldwide in April, this had a huge impact on working mothers. And for single mothers who are taking care of children exclusively, which represent 21% of US children, When schools are closed for prolonged periods, they face a critical choice. They can't work, or if they work, they can't take care of their kids. So this means that 21% of children are at risk of living in poverty. Now, let's look at the intersectional impacts of COVID-19. We know, or at least the data signals suggest, that they're more pronounced for women of color. And women of color already experience significant wage gaps. Black women being paid 62 cents for every dollar that a non-Hispanic white man earns, and Latinx women being paid 54 cents. Many women of color are working in low-wage jobs, such as nursing assistants in home health care, childcare workers providing emergency childcare, and they're less likely to have paid sick leave and less likely to have access to quality childcare themselves. And even though Congress has instituted some special paid leave protections through the end of the year, we still see that this is a robust area for innovation going forward. Now let me mention about the mental health impacts of COVID-19, which also have a gender dimension. Mental health demand through the COVID-19 pandemic has surged. In fact, my colleagues say that we are just now in the middle of the surge with respect to mental health. And we know this from some of the early data signals. The crisis text line and SAMHSA's disaster distress helpline have experienced record usage over the last several months as compared to last year at the same time. And those early data signals suggest that women are more likely than men to experience stress and burnout. In one community survey by leanin.org, 25% of the women they surveyed reported that they had physical symptoms of severe anxiety as compared to just 11% of men. Still, other data signals suggest that the burden on women of color is, again, pronounced. A May 14th survey by Essence magazine indicated that 63% of the Black women that they surveyed self-reported that their mental health had been negatively affected by the pandemic. And as Hannah mentioned, domestic and gender-based violence have increased over the last several months. And it's really interesting because we know this because calls in some areas have increased to metropolitan police departments or to helplines. But in other areas, for example, in Bolivia and Chile, formal complaints have dropped, but the advocates believe it's because there are restrictions on movement and that the usual sources of help are not available. Let me close with a final set of comments on the intersectional dimensions of American policing, because the policing crisis is also a part of this pandemic. While the public's attention has largely been focused on unarmed Black and brown men who've been killed by police, it's only recently that the public is coming to recognize that Black and brown women, like Breonna Taylor, are also victims of police brutality. And when we think about leadership, Kimberly Crenshaw, Professor Crenshaw, who coined the term intersectionality, began in 2015 to raise awareness about Black female victims of police brutality. And that work is now showing itself as it becomes, as she can now point to that stream of cases that have stood out. But I think we need to widen the aperture. As important as it is to say the name of those who are direct victims of police violence, when Black and brown men are killed, women and children also suffer collateral trauma. Just think for a moment about 17-year-old Darnella Frazier, who filmed George Floyd's murder. She's described herself as being traumatized by the experience, but she's also had a considerable amount of vitriol directed at her on social media, compounding her trauma. And finally, we need to appreciate that police-linked intimidation and violence is a regular feature of life for many Black girls in schools. Monique Morris has coined the term school pushout to explain the federal data that shows that girls of color are suspended and expelled from the nation's public schools at disproportionate rates. And teachers and school officials appear primed to see children of color as disobedient, disruptive, and disrespectful. And that's what they use to justify discipline and even referral to law enforcement. So we've got all of these pandemics coming together, and we can begin to see how we have to understand all of them in context. And I'll stop there.
Thank you, Kim. This is so rich, such a rich discussion. Janina is now going to talk, pick up some of these other threads, but in particular talk about some of the economic consequences and how that connects with the caring issues.
And I think you're going to see a theme in a lot of our conversations, that there's just incredible overlap between these different aspects. And I think that's part of the challenge, and also part of our job is to see the connections and not see these as disparate. So on the economic side, as Kimberlyn mentioned, you know, women have been losing their jobs at a higher rate than men, and there's also an intersectional aspect too. And this data is unfortunately a month old. So the nature of these crises is changing fast, but as of the middle of May, for those earning in households earning under $40,000 a year, 39% of people who had a job had lost it, 39%. Compared to households over $100,000 a year, which is still not an insane amount of money, but better off households, only 13% of people who had a job had lost it. So it's an incredible disparate difference, and the households with $40,000 or less have fewer resources to draw upon to weather those shocks. So huge impacts. The childcare impact is also very differential too, as was mentioned, and it has a knockoff effect on women's labor force participation. A lot of times, if you're in a household with two incomes, it's often the case the man is earning more, not always. But if the man is earning more, it may often seem like the woman can quit her job to cover the childcare, and they will lose less income. So we're seeing more women drop out of the labor force, and often women who've just had kids in the last 10 years, that maybe they've re-entered the labor force in more short-term jobs, or jobs that don't have as long a commitment to a career trajectory. So it's also easier for them to slip out of the labor force. So it'd be interesting to see where that happens, and it is a very profound effect. So with the economic ramifications, which my colleagues have touched on, and a few of these that I've emphasized, also the medical and the racial violence aspects too, I think, well, particularly with the pandemic and the recession, in the past decades, we've seen that small changes can have differential impacts. So a recession in 2001, 2008, well, that was not small. It's much less rapid than the current recession. We saw these differentiations, that people of different categories were hurt more. And what worries me now is that we're seeing this on a massive scale. We've never seen the job losses that we've seen in these past 3 months. And so the impacts that we've seen in previous experiences are just magnified to massive impacts. Excuse me. Sorry, I'm fighting a cold. So I think for me, a couple of things to come out of this. One is to balance. We've got to balance the pandemic with the recession, with the racial violence aspects, and constantly work on that and think about subgroups. And secondly, we need to think about all these factors when we come to repair. And we can't think about just one aspect, but we have to think about all these aspects and how they overlap. When we come to think about what are we doing now? What are we doing in 6 months? What are we doing in a year? Because these are enormous changes, and they're very, very strong differential impacts. And so it's really crucial that the public policy work going forward, excuse me, is fine. So yeah, thanks. And I'm sure we'll hear a lot of these themes come up again.
Thank you, Janina. Zoe is going to be our last panelist and bring some of this together, particularly around intersectionality and around leadership, and are there gender differences in leadership?
Great, thank you, Sarah, and thank you for convening this conversation. I have to say it's really risky to ask a feminist scholar with a global outlook to talk about gender and COVID, because as you can tell, like everything is here for us to unpack. But luckily, I'm with some of my favorite and most admired colleagues who've done a tremendous job. So most of what I say will echo and expand upon what Hannah, Janina, and Kim have already shared. I wanted to go back to Hannah's gesture towards this being a gendered moment, and to talk in particular about what the gendering of women and feminized people, people who identify as women or as non-conforming folks. What that means, and it usually means that we're put into a paradigm of either being victims or saviors. And it's really hard to break through that. But I want to sort of map out some of the ways that I think this moment in its reality and its empirical lived experience has broken through the victim and savior paradigm. And I want to do that by centering my comments on Breonna Taylor. So as we all know, hopefully by now, Breonna Taylor was killed in her own home while she was asleep through the execution of a no-knock warrant for people who were already under sort of police control. And the reason I want to center her in this conversation, while I'm going to focus most of my remarks on the pandemic and its impact and response, is because she was a healthcare worker. She was literally an essential worker doing the thing that everyone had rainbows and teddy bears and signs out to support, and yet our state is built in such a way that it took her life while she's saving other lives in her own home in what should be her own private property. And the reason that's so important is because it gets to these structural issues that Kim mentioned around intersectionality, and it helps us reveal the ways that people are disproportionately vulnerable to this pandemic and vulnerable to COVID, and also vulnerable to all of the underlying risk factors that have made mortality rates higher, particularly in communities of color, as a result of environmental injustice, right? As the result of the fact that their communities are more likely to be in insecure, unstable housing. They're more likely to be near pollutants. They're more likely to be in neighborhoods that don't have direct access to healthcare. They don't have social support services. They don't have as much access to fresh food. All of the basics that keep us alive, that people in communities of color are providing as essential workers during this pandemic, and that have helped to carry the country through it in not particularly good fashion. That's where intersectionality actually becomes a life or death matter, right? That's not just the case of an officer pulling his firearm. It's a case of a systematic disinvestment from communities of color. And the reason I say that these communities have pulled us through is I want to offer you a few statistics. So globally, 7 in 10 health workers in the health sector specifically are women, right? 70% of health workers globally in America and in other countries and continents are women. 9 in 10 care workers in this country are women. And I mean care workers in the broadest sense of the term. So if we think about the people who are looking after our children, if you have the resources to hire a nanny, if you're hiring people to look after your elderly parents, if you need somebody to provide psychosocial support in a group home, 90% of those workers are women. Now, when it comes to thinking about care workers in the site that has been hit hardest in this country, which is in nursing homes and homes for the elderly, assisted living facilities, et cetera, 1 in 4 of those workers is a migrant. Many of them are undocumented. They don't have access to the types of services and the types of social safety nets that the government has been trying to roll out, even access to safe and secure testing without potentially losing their status or exposing themselves to deportation and exposing their families to that risk. And 50% of those care workers in this country live below the poverty line. And so when we talk about intersectionality, as so many of my colleagues have just done so eloquently, what we're really talking about is this choice to underinvest in communities who we are entirely dependent on for our health, safety, and well-being during a crisis, but also as antecedents to the crisis, right? They've been doing this work throughout, and I think it was so impactful to hear Janina mention the layoffs that are happening in poor households at this time. And so that in and of itself is really quite overwhelming. But I also don't want to put it in this paradigm of victimhood, because it is not necessarily the case that what we see is just the rampant victimization and exploitation of essential workers, of paid care laborers, of unpaid care laborers, and of single mothers. But it's rather an opportunity to think about the knowledge and wisdom that is located in people who are able to do so much with so little and are systematically underrepresented in leadership. And so when we look back into the healthcare sector at the leadership, there is, unsurprisingly, a significant overrepresentation of men, mostly white men in this country, but in other countries, we see the same patriarchal pattern in who makes policies, and particularly health policies. And when we go up to the highest level, to heads of state, 90% of heads of state are men. And so I want to remind you that 90% of care workers are women, 90% of heads of state are men. And I think that part of what we can begin to think about is if we shift that balance, if we shift that ratio so that men are able to do more care work, women are able to rise to the highest levels of elected office, we will actually begin to see that we all understand each other's situation better. We're able to make smarter investments. We're able to break through some of the inequalities that we've otherwise been suffering the effects of. And some of the women who've been getting headlines actually are female heads of state whose countries have been doing quite well. And so I'm not going to list all of them, but I encourage you to Google it if you haven't been tracking all of the headlines. I wanted to mention just a couple that are outliers because they don't get the headlines, but they're doing remarkably well and have female leaders. And so some of you have heard of Jacinda Ardern's work, Tsai Ing-wen in Taiwan. These are countries that have gotten huge accolades, and rightly so, for almost squashing the curve, but also slightly more esoteric countries, if I may say so, and welcome to any of you who are listening in from these places. But Estonia, Georgia, Slovakia, these are countries that also have female leaders, some of whom had just come into office. Finland has one of its youngest head of state in history. It's this millennial prime minister who gets accolades for being a prepper in actually preparing her nation for care. These are countries that don't necessarily have the most resources, but by doing what's called participative leadership, by making hard decisions and making hard decisions in public, women have really blazed a trail for how to have conversations that have otherwise not been rewarded in politics. And so I think just to bring it back to Breonna Taylor and to keep that as a sort of a frame for thinking about some of these problems, we can think about the work she was doing, but we can also think about the women, as Kim mentioned, who have mobilized a movement, not just for Black lives, not just for all of the lives who are touched by Black lives, but specifically for Black women and queer and trans Black people who are trying to build a better life so that they can survive, but that also so that their movement is grounded in communities. And I think that there's an interesting initiative that's happening at the moment in Hawaii, which is the Feminist COVID Recovery Program. So even within our own country, which has highly erratic and often dysfunctional leadership, we can see that these conversations are happening not just in the streets and at protests, not just here at the Kennedy School when we have time for a dean's discussion, but they're actually happening in some of our own states at really kind of innovative and creative levels. And so I encourage you to look up that conversation about Hawaii's Feminist COVID Recovery Plan. I think we can think about what would a feminist plan for anything be, and if we take that lens of intersectionality, that lens of gender equity, it's really an invitation for us to think, okay, maybe instead of paying companies to retain workers, we could pay the people who are teaching their children at home. Maybe instead of paying companies to stay open, in spite of the fact they have no customers, we could pay people to take care of their elderly relatives so that they're able to stay safe during a pandemic. And those sorts of creative solutions really only come out of listening to women at the front lines like Breonna Taylor.
Okay, thank you so much. Thank you to all four of our panelists. We're now going to open it up to questions from the audience. And for those of you who are not familiar with the Kennedy School tradition of question asking, or to remind those who are, is that the way to ask a question is first identify yourself. Secondly, in this group, since we have four panelists, direct it towards a single panelist if you can. If you can't, I'll help direct it. Third, be brief, one question each, be brief. And four, a good question ends in a question mark. So please raise your hand virtually and we will start the discussion. Okay, be brave. Okay, let's hear Nicholas Song.
Hello, thank you. Professor Marks mentioned the global outlook in our presentation and touched upon many developed nations like New Zealand, Taiwan, and Finland. So I don't know who to direct my question to, with Professor Matuszeski as a returned Peace Corps volunteer, Professor Chenoweth also on the call, and Ambassador Sherman, but I'll direct it to Professor Marks. What are the implications of the global pandemic on women in the developing world?
Are we going one at a time? Should I take that, Sarah?
Yeah. No, it's directed at you. So you can...
Yes, okay, thank you. Thank you so much for the question and for giving me an opportunity to expand. So I think the implications are that the minimal social safety net that we've seen in wealthy countries is relatively non-existent in developing countries. But also, you know, my work tends to focus on Africa, and I'm currently working with the government of Sierra Leone, which is able to catalyze some of the COVID recovery funds that have been available, largely through multinational coordination, some of which has been led by some of those wealthy country female leaders that I mentioned. Norway and Switzerland were the first out of the gate. Sierra Leone and other countries are trying to actually harness what they've already learned from previous experience with pandemics, with contact tracing, with community-based leadership, with outposts for community health workers in rural areas. There are some, I think, really important and surprising lessons that can be learned from Southern countries who are resource constrained, but are not creativity constrained. And so my first thing would be to just make sure that we're always kind of challenging our assumptions about what it means to be resource rich or resource poor. But the other thing that I think is happening for women specifically is, without that safety net, lockdowns have been really devastating. And so it's been much harder for women to access even minimal services when it comes to you know, intimate partner violence and domestic abuse. There has been some recent news out of South Africa that women were experiencing relatively silenced patterns of domestic violence, but after the lockdown ended and alcohol sales resumed, there was a huge increase in murder of women. Countries like Argentina, which are not poor, but they also have seen their highest rates of femicide, killings of women, in 10 years. And so I think, unfortunately, what Hannah and others mentioned around this nexus between the domestic space and kind of the household as a haven is being broken apart in some small ways by the knock-on effects of the pandemic.
Janina, because you work so much on issues with developing nations, do you have anything to add to that?
I'll just add a few ideas building on what Zoe said. I think that we have to think about what resources are. It's the number of ventilator beds, but it's also, as you say, these systems of contact tracing. In areas that had a lot of Ebola, actually, they had to learn a lot of this. And so systems are building upon that. So I think it's very idiosyncratic by country, and but it is really important that we're aware that the resources available in the US, even though they don't seem enough, are really not there. And we have seen countries very hard hit, like Ecuador and Brazil, very hard hit. And you know, certain cities will be hard hit. So it is a great tragedy around the world. And I think it's taking really smart thinking at the state and local and regional and national level to say, what can we do with the resources in our country? Can we get a system where everybody really is using masks and social distancing? And can we get the contact tracing? Do we have community health workers set up to do that? It's very idiosyncratic, and I appreciate the question, because we're in this as a global community. So thanks.
Thank you. Next questioner, Carlos Carpi.
Thank you very much. Thank you very much to the panel. Coming from an international development perspective, I'd love to hear some of the comments on the panel on what you think the role of the institutions like the World Bank, that recently got its capital increased particularly for the IDA replenishment, and in kind of putting together some of not just COVID support, but also bringing other agendas such as gender to the table as we try to not just support countries in the emergency, but restructure some of these governance structures. Thank you very much.
Do you have individual panelists you want to direct that to?
I would humbly suggest whichever one of the panelists would like to comment on it. It would be very flattered. Thank you very much.
I think Janina should take this one.
Sounds like Zoe has taken a step forward.
Oh, she recommended me. I'll say a few words.
Oh, okay, sorry.
I think it, you know, again, there's so much complexity to it. And it's very idiosyncratic. I think this is a chance to think of this as an opportunity as well. And sometimes systems get into place and, you know, people stick with those systems for a long time. And so you've got some severe crises hitting around the world with global recession and the pandemic hitting everybody differently. So I think I would encourage those working with the World Bank and countries taking advantage of the new funds to think, you know, holistically about not just one problem, but the joint set of problems that they've got. And as we've been talking about, the different sectors being hit in different ways, different households being hit in different ways, and think creatively about what do we want to build coming out of this that really addresses the pandemic and the recession, but also builds a stronger society so that when something like this hits next, we've got our systems in place. So I would hope that that's the approach that's being taken with the new funds, both from the World Bank and from individual countries. It is a huge challenge. And, you know, for a school like ours, there's always enough public policy challenges, but they seem to have multiplied, you know, 1,000-fold this year. And it is a fascinating and horrifying set of circumstances to contemplate.
Thank you. Hannah, did you want to comment?
Thank you very much.
Just wanted to,
Yeah.
just wanted to add that it even though that's not my area, what the World Bank does, I can say that it seems important at this particular moment in time to ensure women and others equal representation in the response planning and in allocation decisions for exactly the reasons that Zoe mentioned. There is creativity and innovation that we need to tap. And so as we begin to look at who's affected, which is all of us, but not equally, to have representative voices shaping how those dollars and other funds are spent seems quite important.
Hannah,
Thank you very much.
Yeah, I just want to jump in on that. This is not my area of expertise, but we do at the Women in Public Policy program, we have a couple of fellows who are looking at domestic or sexual violence from an international perspective. And I do think that is one area where there's important international work that's being done that is also, you know, acutely needed and would be a place to direct resources. So a number of the panelists have highlighted the loss of communication channels to report domestic violence or to, you know, even just escape and get protection or other types of resources. And so I know there are people who are looking at these questions of what evidence-based interventions that we have that could be brought to scale currently in the crisis. We've got one fellow, Nisha Prakash, who's looking at this, but he's also looked at, for instance, in India, what are the implications of having women on police forces for the reporting of sexual violence. So he's one of our fellows at the Women in Public Policy program, looking in very, I think, important and innovative ways at these questions. Another leader in practice we have is a woman named Rangita De Silva, who has been advising, maybe you know, Carlos, Rangita, you're nodding your head, but she's done very important work at the international level, the level of international institutions, advising on questions of the reduction of sexual violence. So she's another potential point of contact on that topic.
Thank you very much.
Our next question is from Professor Wendy Sherman. Welcome, Wendy.
Hi, thank you. First, I have to point this out because it's my bent to do so. The vast majority of people on these screens are women, and the first two questions were from men. So I'm taking my own advice to ask a question, and I urge the many, many women on this screen to put your hands up. Don't worry about what you're going to ask. Ask whatever's on your mind. It doesn't have to be perfect. Quite crucial. Two quick points before I ask my question, but I will ask a question, Sarah. The gap between the rich and the poor is going to increase because of the intersectionality of all these challenges. It was bad before. The economists on this screen know better than I. It's going to be even larger, which means the recovery and the intersectionality of repair is even more important. Secondly, there's an enormous concern that girls in the developing world will not go back to school. And the single biggest indicator of increasing GDP, or one of the single biggest indicators, is girls getting an education. So we are creating a further crisis and a further setback, and Janina and Oxfam know this extraordinarily well. My question to you all, I don't think there's evidence of this yet, but I'd be curious what you think. Now that we have women and men at home taking care of children or in the presence of children, do we think it will create any long-term awareness, ability to take on the issues that you raised of whether in fact we might someday pay more for childcare, pay more for school teachers, share the responsibilities of parenting? I know, Hannah, you ran out of time to talk about fathers, but do we think this will help change a paradigm, which I have seen some change in younger generations of more even split and more attention to this? So I'd be curious about your predictions or your hopes. Thank you.
Do you want to start?
Yeah, can I jump in on that? So I think this is a really interesting moment for the gender division of care labor. So we have to acknowledge right up front that women have traditionally and continue to carry a disproportionate amount of this. So this is not to take anything away from that, but we are seeing evidence of men, like women, becoming increasingly involved in caregiving, particularly, you know, if they're in a household situation where they're there. But even, I mean, there's a lot of evidence that even non-residential fathers, right, are getting more in the game. And there is evidence from Europe, from the social experimentation, the policy analyses that have been done there with regard to the lasting effects of things like paid paternity leave for dads, like daddy quotas or daddy days. And what's fascinating about that work is it shows that even a relatively short amount of time, like a period of weeks of access to devoted to childcare, has lasting implications for men's relationship with their children, how their children see them in terms of the division, not only of care labor, but also of household labor. And so I have this kind of hopefulness right now that we're going to see that this is going to turn into a moment where guys are getting in there in new ways, and they're going to kind of love it. I mean, it's hard, but it's really great too. And that you're going to see this kind of, that this is going to add a little boost to what you already see from younger generations of men wanting to be more engaged fathers than is the traditional norm. So I'm actually very hopeful about that. Can I also, I also want to highlight a couple of other things picking up on, which is related to this and picking up on Zoe's comments. You know, I've been very interested in more like hyper-masculine stereotypic guys or fora talking about the importance of care work. So for instance, like a week ago in the Wall Street Journal, top of the banner, they had an article on the importance of care workers for the disabled. I mean, they had a whole article in the Wall Street Journal about care workers for the disabled. And then just last night I was watching, I don't know if it was the chief of police or some senior police executive in Houston saying, you know, we can't tell Texans to wear masks because they don't want to be told what to do, but we can appeal to their sense of care and compassion for their fellow citizens. I mean, I do think we're kind of at this moment where it's not just elevating others who do that care work. It's really, we are kind of more broadly as a community, I think, embracing and elevating the importance of that work.
Nina, did you want to jump in? You seem to want to jump in.
I just add 2 words. I think that the impact of the pandemic and the recession on households is so idiosyncratic by whether you're an essential worker or not, whether you can do your job from home, whether there's 1 parent or 2, how old the children are. 1 and 3 is different than 4, is different than 7, is different than 10. How much you can leave your kids alone. If you are partnered, if there's 2 of you in the home, whether your partner's job respects the fact that they now have 20 hours a week instead of 40. I have many colleagues who are working in groups where everybody else in the group has a stay-at-home spouse. They're mainly men in the tech industry. They have a stay-at-home spouse, or somehow they have a grandparent or something who's living with them, and so they've continued their work as usual. Whereas, for example, my husband and I have had to split everything 20 hours each. So I think it's very idiosyncratic by the age of the children and by the household, and whether you have to leave the home and get a babysitter or not. Oh, sorry, one other thing. I think that it's really important for fathers to have soul care. And there's an economic concept called residual claimant. It's whoever gets everything that's left at the end. And if you're helping or you're co-parenting, it's not the same as you're in charge and you're it. So I think that's one reason that this paternity leave is really important. And I saw it when I have twins who are now 7, when my husband had them for 3 weeks when they were 5 months old. He knew them more than I did. So it wasn't mama knows best. It was parent who's with the kids who knows best. And that was a really important lesson for both of us. But it's because he was in charge of them by default. And if you're not in charge of them by default, if you're just helping, I don't think you'll see the care. So to the extent that moms are still taking the lead at home, you may not see the shift. But to the extent that dads are required to really be the default parent and take the lead, maybe you will. But those are my unofficial observations.
I did see one survey in the New York Times that said 53% of the men said they were doing the bulk of the homeschooling, and I think it's 3% of the women said the men were doing the bulk of the homeschooling in the same survey. Next questioner, Kate Hamilton.
Hi, everyone. I so enjoyed this discussion, and I also have a lot of favorites on this call, so nice to see you. So my question is for anyone on the panel, and it's thinking ahead to the future and thinking ahead to the election, which I know lots of thoughts about that. So in our previous Dean's discussion, Nicholas Burns said there's 4 crises going on right now. So the global health pandemic, the economy, racial violence and police brutality, and a crisis of leadership. So I've been thinking more about, if, for instance, Joe Biden won, who might be his vice president. And obviously there's been a lot of talk about him choosing a female running mate, and particularly a woman of color. So my question for the panel is, how might this change the tenor of the discussion around these different intersecting crises? Or how would you like that to change the tenor of the discussion around some of these crises that came up here? So very open-ended.
We'll start with Kim.
Well, I think there's certainly a lot of hope and expectation on whoever will be the chosen running mate, and whether she, if it's a she, will be able to speak to the many different constituencies. I think it's important to realize that there is a crisis of leadership. It is also incredibly difficult to lead right now, because the communities that you're trying to lead want different things from you at different times. And some of the terrible trade-offs that people are making, admittedly not well, are still going to be there even under the best of circumstances. I think my hope, my wish list would be that this conversation that we've just had about how we value people and work who sometimes don't seem to make it into the equation is what I would be looking for. I think this would be a very different nation if we had reliable, quality childcare that was available to all families. I think it would be a very different country if the low-wage workers who we are so dependent on for our very lives were compensated fairly. And I think when I think about that America, that strikes me as a place where there's a lot of hope, and there's a lot of people waiting in the wings who are ready to take up that mantle for leadership. I think what's been amazing, really, when you look at the number of people who are in the midst of being vetted, from the seriously vetted to the a bit vetted, as I saw in one recent media story, what should impress all of us and what should give all of us hope is that there are a terrific number of possibilities, any number of whom could step in and do, in my view, a quite excellent job.
Thank you.
Hannah?
Sarah, can I come in on this one?
Zoe? No. Hannah, you're muted.
Can I go? Do you want to get, I'll go really fast, or do you want to, you go first, Zoe, you go first.
Go ahead, Hannah.
All right, so really fast, I just wanted to highlight, there's a concept developed by Robin Ely and David Thomas when he was at Harvard Business School. David Thomas is now the president of Morehouse College, which, if you're not familiar with it, is one of our most prestigious historically Black colleges in the United States. Brilliant, both of them. But they talked about what types of diversity, different types of diversity initiatives or frames of diversity. And one is simply fairness. You kind of demographically get the right categories of people in there. Another one is legitimacy and access. You bring like minorities in order to get access or legitimacy within a particular community. And the third, the highest level that they argue, is what they call learning and integration. And that is that you're not just simply trying to get the right type of people. You're not trying to get, you know, have those people deal with the right communities, that you're actually bringing people in and you're going to allow them to change you and your organization. And so success for me is if they bring in somebody who is going to actually help us change, learn, and change our perspective on these types of things. But Zoe.
Yeah, and I thought you were going to say what I'm about to say, which is that I think it's also imperative to inject this conversation with the phenomenon of the glass cliff, which is this idea that during moments of crisis, and it was developed in terms of research on companies and corporations in particular, boards are much more likely to appoint a female or a racial minority CEO during a crisis when there's imminent failure. And I think that it's fantastic that Joe Biden has verbally committed in public multiple times to having a woman. And I'm absolutely delighted that a lot of people seem to be rallying around Black women for this historic moment in our nation's everlasting transformational process. But I also think that for those of us who are interested in supporting women in difficult positions of leadership, we should know about the glass cliff. We should know that women and underrepresented people are more likely to get opportunities to lead when things are most set up for failure. And I think that that is, you know, partly, you know, carried through in Barack Obama being elected in 2008, that there are these sort of breakthrough moments, but we need to be realistic about what the tools are that person is being given, and then do our best to help change that conversation in the wings, right? And so what I would like to see change, to go back to Kate's specific question, is regardless of who the woman is, the conversation of who it's going to be totally stresses me out. But regardless of who it is, I would love for them to be able to animate the political imagination in America so that we no longer think that working class is a dog whistle for white American blue collar men, but that we actually know that the working class is those men and single mothers and immigrants and communities of color and all of the people that we've been talking about as essential workers for the past many months. And so that would be my hope, that we can have a new conversation about what it means to be working class and working poor in this country.
If I could just add one more coda maybe. I also, to this very important idea of the glass cliff, maybe another perspective too. It is true that many people of color do get appointed to leadership positions under these kinds of conditions, but many of them do an exemplary job and they stay on. And this becomes a pathway to also bringing others along too. So I want those changes, but I also want to really affirm those women and people of color who, however they have gotten into office, some of them have done extraordinary jobs.
Do we have other questions? And I'd love to pick up on Wendy's point that it doesn't have to be a perfectly formed question. It doesn't have to be a perfectly articulated question. We want people to just help us continue this discussion. So, okay, Patricia.
Thank you. Thank you, everybody. Really amazingly insightful conversation and so much to ponder. I'm always in these talks looking for hope everywhere. And already I've heard a lot, but I'm just wondering, as you see these instances of things going in the right direction, how hopeful you are that they are going to be both documented, and again, some of them are being documented by HKS, which is great. But like, you know, I'm thinking of some of the amazing leaders, female leaders that are coming out. Monica Cannon Grant here in Boston, I've been just incredibly taken by how strong and amazing she is. And I just worry that we're going to have these moments. I'm a pessimist, so I worry that we're going to have these moments of being in awe of these leaders, and there's not going to be a movement behind them or a steady wave of support that's going to continue. You know, I'm always worried about the ephemeral nature of some of these moments, and so I know that already it's been much better than a lot of us expected, but I'm looking for ways to think about these ways that we can all help these stories and these best practices and these amazing leaders that are rising to just be seen by more people, to be heard by more people. So it's a little broad and vague, but since you were given permission for that, I thought
the question mark at the end there is how to keep it moving.
Yes, exactly.
Progress moving forward.
Yeah, and expand the number of people who know about all of these things that you all have talked about and those that we're reading about.
Does someone want to?
Thank you.
I'll jump in. You know, as we all know, a lot of institutions, including all the institutions at Harvard that I'm a part of, have put forth statements pertaining to Black Lives Matter, to racial equity. And of course, the statements are just the first leg of work. So how do we know that the work takes off? Well, we continue to be pushed to do the work we've said we were going to do. And I think that is the case for those who are in elected office or those who've been appointed. There is a relationship between the people who empower you to be in office in one way or another and what you provide them. So what I'm looking for right now, to your question, is I think if you're practicing leadership, if you're in an authority role, that you're going to be looking to see are people continuing to push you to do what you said you were going to do. I think that's an important part of what it means to move change forward. That's one way I'd reply to your question.
Other? Zoe.
I mean, I guess I would just add, I think, oh, sorry, is that okay? Oh, please.
Oh yeah, Zoe, Zoe was, how about Zoe then Hannah?
Okay.
No,
I was just going to say, I think
you and I are always jumping in simultaneously.
we have exactly the same pause where we're like, all right, we'll do it. Thanks, Sarah, and thanks, Hannah. I was going to say, Patricia, I think that it's so true that often women do get written out of history. But to me, one of the things that I would love to see happen is for the right lessons to be learned, right? So the lesson is, yes, of course, we'd love to, you know, see the end of patriarchy and see women have equal access to positions of power, influence, and authority, and maybe even just change what we think authority looks like. But more importantly, there's this research that finds that when women do well, they're given this sort of like, oh, they were lucky, or they're in the right country. And when men do well, it's they were skillful leaders. And, you know, if we stop doing that and we actually recognize that women are being skillful and there's a skill that we can take away, I think the core skill that this moment has shown is that empathy is an absolutely essential component of effective leadership, because you have to be able to empathize with the people you're leading or that you're making decisions on behalf of. Sometimes millions of people's lives are in your hands. If you cannot empathize with what they're experiencing, you cannot make a smart decision, much less communicate it well. And so I've recently been doing some research looking at conflict and recovery in Northeast Nigeria. And as a result of that research, was deep in the weeds of gender and empathy and psychology. And, you know, there's actually really limited evidence that there's a gap, a gender gap in actual empathy. That if you ask people to self-report, women will self-report significantly higher levels of empathy than men. but actually it's because we're socializing women to say that they're empathetic, to know that they're empathetic, and we're socializing men to do the opposite. And we can see that in some of the most ineffective male leadership that's happened during this time, is this real intentional effort on the part of some of the most disastrous male leaders to repress their empathetic instincts. And I think for me, the core lesson that's coming out of the coronavirus pandemic is that there is a skill, it is called empathy, and there is equal, gender equitable across all genders ability to exercise that skill and apply it to leadership.
That's great. Thank you. Thank you.
Yeah, I just want to pick up. So I'm not sure everybody recognizes that Patricia, who Patricia is in our community. So she is I don't know if I'll use the right word, but you are somebody who makes video documentaries, who has been bringing your talents to the Kennedy School to create video-based case materials. And I just wanted to highlight the importance of this. I mean, one of the reasons why we make these naive associations between masculine attributes and leadership is because men tend to dominate leadership roles. So when we say conjure up a leader, you conjure up a guy, right? And now when you look at what are the attributes of a nurse, you tend to conjure up a woman. And then so we associate, masculine attributes with male leaders and, feminine attributes with nurses. But in the way that we've been trying to like get more men into nursing, all of a sudden now we're highlighting, emergency response and carrying heavy things and decision-making under pressure. I mean, those have always been aspects of nursing, but they've kind of gotten disappeared by the feminine stereotype of the nurse's caregiver. And so anyways, my point, what I'm steering toward is your work of documenting women in leadership. I mean, it's actually plays a very substantive role, because when people conjure up leaders, I mean, by making available exemplars that are women and exemplars who are demonstrating compassion and care or elevating participatory processes, we are loosening our stereotypic associations between these, kind of stereotypes, masculine and feminine stereotypes, and the role. And so I just want to thank you for your important work, because Patricia has done important work on cases on Aung San Suu Kyi, and a number of one that we've worked on lately with Nadine Vogel, and a whole variety of others that I can't even remember. But I think what you're raising is a really important point, that we make a point at the Kennedy School to teach from these diverse examples, so that we break down those naive and distortionary stereotypes.
Thank you so much. Thank you, Hannah.
I'd also add that the opportunity is there to document what empathy looks like in different forms and in different contexts, because it can be thought of as a soft skill, but it's an equally hard set of capacities to grasp. Zoe knows this, I know, from her conflict work, and to have different models of what empathy looks like in real time and in action, and to give our students opportunities to exercise that empathy, which often means also holding curiosity at times when you're least interested in what the other person has to say. That's an act of empathy too, and so critical to being able to mobilize people on behalf of these intersecting challenges that we've been discussing this afternoon.
Well, I think that we are unfortunately out of time, and I want to give great thanks to our panelists who are role models and have evidenced both deep expertise and deep empathy today. So thank you both virtually and in real life